Hi, I'm Dr. Maxwell Synsvoll with Synsvoll Chiropractic in Battleground, Washington. If you're watching this video, it's because either you or a loved one has a condition known as neuropathy. And neuropathy, as we have listed here, can come in many different packages. It can be from being diabetic, it can be from heavy metal exposure, it can be from trauma to your spine. It's generally classified as a numbness or tingling, shooting pains that happens in the legs, feet, or toes, or into the arms or into the hands. We've seen at this point hundreds of people over the last year with this condition, and up to this point we have an 87% success rate and satisfaction rate with the patients that we are helping with the condition. This is not a cure for neuropathy, but what we do does help people with this condition without the use of dangerous drugs, without the use of surgery. And many people who have this condition are told that it's permanent. It won't go away. It can't get better. And I can tell you that there are many people who we deal with where the problem does go away. And there's other folks where it simply gets better. They're able to sleep easier at night. Their legs aren't going crazy as much as they're sleeping in bed. It's not waking them up as much. And for them, they're happy and pleased with that result. So what makes us different and how do we successfully help this condition? Well, in our office, we take care of people via specific metabolic and neurological testing, very specific analysis of the bones, muscles, ligaments, tendons, nerves in the spine and the nervous system. And then based upon that, we do treatments that are specific to the person. Some people do need a very broad-based blood analysis and hair analysis done when they come in. When I say broad-based, the testing that we do looks at everything that we can possibly get to in the body, and we look to see if it's in a clinical situation or if it's in a healthy situation. And there's two different numbers for that, and I sit down and go over all of these blood tests with our patients as they come in. Once we address those underlying what we call metabolic problems, that's the metabolic testing, many people's problems go away just from that. Some people, I can think of one person in particular, when we did the hair analysis with them, they had high levels of lead, mercury, arsenic, and cadmium in their system, which was causing, as we found out, the neuropathy that they had. And as soon as we cleaned that stuff out of the body, which is very simple to do this, it does take some time to do it, but as soon as we cleaned that out of the body, their symptoms began to go away. On the boards here, you'll see some of the things that we test for and that we look for as far as hormone panels, neurotransmitters, inflammatory panels. We may use glutathione in the treatment of this. If you're not familiar with glutathione, well, glutathione is the mother of all antioxidants, and everyone's taking antioxidants these days. Well, we have a specific way of getting this into people's system that it helps to decrease inflammation very quickly, and it's very safe and it's very easy to do. We want to determine if there's an active antigen or dysregulation. Well, what is an antigen? An antigen could be a parasite. What? How could you have a parasite? Well, based upon the blood testing we do, we'll know if you have one or not. Bacteria, viruses, mold, yeast, fungi, protozoan, foods, chemicals, heavy metals, as I said previously. We look for H. pylori. We can do a specific test for that. We look for intestinal permeability of your gut to see if you're absorbing your nutrients appropriately. We can do specific immune panels. We don't do all of these for every single person, but we do them based upon what's necessary for you. Immune panels, interleukin 2, interleukin 4. There's two parts of the immune system. There's a Th1 side of it. There's the Th2 side of the immune system. And we want to see which side of your immune system is stronger or weaker, depending on what your symptoms are. We may do sensitivity testing to any foods that could be setting things off as well. There's some people that are allergic to wheat. There's something in wheat called gluten. Sometimes gluten can start to cause these neuropathic or pathological problems. Adrenal stress index to see if your adrenals are working appropriately. And then based upon what we find there, we may do one of the following. Oxygen therapy. Your brain works on two things: fuel and activation. Fuel in the form of oxygen, glucose is another part of the fuel, and then 2 is activation. So if you have all of those in combination with the treatment that we do here, you respond much more quickly. We do brain-based therapies, Laser therapies, no, this doesn't hurt. It's a cold laser that gets inflammation down in whatever extremities are affected with this problem. We may use an interactive metronome, which is a computer-based program that uses visual, auditory, motor stimulation to increase the firing of the brain. We may use any one of those or all of those for your specific condition. So ask yourself the following questions. How has your chronic condition affected your job, your relationships, your finances, your family, other activities? Are you able to do the things that you'd like to do? Are you able to sleep at night? What does it cost you in time, money, happiness? Where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? And what is it worth to you if we could improve your condition? We don't accept everybody for this program. We need to see specific things based upon your evaluation as to whether or not we can help you. So if you're interested in seeing if we can help you, simply contact us at the telephone number that's listed on here or is on the website, or talk to the person that gave you this DVD. And we will always honor a free consultation. Sit down and see if you can be helped. And if you can be helped, then I'll explain everything to you that we're doing so that you understand this whole process, and we can look forward to getting you better in that case. Thank you very much for taking the time to watch this. We look forward to seeing if we can help you.